Hello. How's it going? Hello, everyone. So we have a very informative discussion today. So I'll give people a few moments to join. But I really wanted to come on and, share some knowledge, particularly about, sexual and gender identity and sex and how, share some of that stuff. H-Town 1906. Nice to see you on live again. Thanks for joining us. All right, so let's get started. So I do want to point out that, in the last few months, Whitman-Walker's community health department has expanded its outreach efforts to social media, which is why I'm here delivering the news, the information, whether that be on HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. So a lot of the series that we have doing were surrounded around COVID. Obviously, we're still in a pandemic, but today I wanted to switch it up a little bit and kind of focus a little bit on sexuality and gender and sex and how all those things come together and how help you all understand the dynamics, new dynamics that we've discovered around sexuality and gender and sex. So there's really three important pieces around identity. So you have sexuality, gender, and then sex. They are all interrelated, so I'll talk about how they fit together with each other, but let's first start with sexuality. So first thing first, sexuality is a spectrum. I know that a lot of people may think that sexuality is binary, either you're gay or you're straight, but there's a lot of in-between and outside of the in-between when it comes to sexual orientation. So sexual orientation, it can change throughout your life, and that's completely okay. You don't have to identify as gay today and be gay tomorrow. If that changes for you, that's completely fine. Sexual orientation can also be defined as like patterns of sexual, romantic, and emotional attraction. So it's bigger than just sex itself, right? So again, those can be sexual, romantic, and or emotional attraction. So one sense of identity is based on those particular attractions. It's also important to know that gender identity is different from sexual orientation. So gender identity, according to GLAAD, got that wrong. According to GLAAD, sexual orientation is the scientifically accurate term for an individual's enduring physical, romantic, and or emotional attraction to members of the same or opposite sex, including lesbian, gay, bisexual, and heterosexual straight orientations. So the National Center for Trans Equality defines gender identity as your internal knowledge of your gender. For example, your knowledge that you're a man, or you identify as a woman, or you identify outside of both of those as another gender. In contrast, gender expression is how a person presents their gender to the world, to the outside. So it's how they present themselves on the outside. So you have your gender, how you identify, and then you have gender expression is how you present to the world, how you come to the world and your appearance. So like sexuality, gender is a spectrum. So all of these things are actually a spectrum. None of them are binary. So let's debunk that theory. So gender is bigger than just, someone who identifies as man or woman. There could also be those who identify somewhere in between or even somewhere completely outside of that framework. So these folks often use umbrella terms like non-binary or genderqueer. So those folks who are, somewhere in between or outside of that spectrum, they identify as non-binary, genderqueer, or something else. It's not limited to those two. They see themselves as not like fully masculine or feminine, and so they, in a sense, break away from that gender binary identity. So now let's throw sex back into the mix. So sex and gender are not the same thing. Gender, as we just discussed, refers to the social constructed characteristic of masculinity and femininity, right? And so if you didn't know, masculinity and femininity is a social construct, meaning that society has basically generated what those things mean, and kind of has imposed certain values and things on those two things. And so sex, on the other hand, strictly refers to biology, right? So if one binary of gender, when we think about binary gender, it's men or women, right? So the binary of sex includes male or female. So males are traditionally born with male chromosomes, that's the X and the Y, gonads, male sex hormones, and male genitalia. Females are traditionally born with female chromosomes, 2 X's, gonads, female, sex hormones, as well as female genitalia. So, on the contrary, it's important to note that, again, there are a few individuals who blur that male-female binary line, right? Some are born with several variations of sexual characteristics, including chromosomes. So there are people who have multiple X's and Y's and have been born that way. There are people who have been born with both genitalia, both sex hormones, both gonads. So they don't fit that traditional aspect of what a male definition is or what a female definition is, just based on their biology and their bodies. So we may call these individuals, or they might identify as intersex. An important intersection of gender and sex is also transgender folk. So the term transgender refers to those who have gender identity or gender expression that differs from the sex that they were actually assigned at birth. And I want to point that out. Sex assigned at birth, right? Sex is self-determined. Let's put that out there. But these transgender people identify outside of that assigned birth sex. So individuals who identify as transgender do not have to have, the medical procedures or assistance to actually identify as one sex or another. So some of those folks actually decide to, go through, surgical procedures and things like that to more closely identify with their particular sex. But that is not necessarily an identifier of someone who identifies as transgender. So when we talk about LGBTQ plus communities, we're also talking about gender variant and sexual variants in a community. So those folks can identify with different identities of race, age, countries of origin, socioeconomic status, health needs, healthcare access, and barriers to all of those things. So let's bring all of these concepts together. I know that is a lot of information, but these are all going to come together, and I know it could be a little bit confusing. So if you have any questions, feel free to drop them in the comments, and I'll try to address those for you. So let's bring these 3 concepts of sex, gender, and sex all together by discussing sexual orientation in a little bit more depth. Sexual orientation, gender identity, and sex are all identities that exist on a spectrum. We said that each of these things exists on a spectrum. So it can be a little complicated to talk about, a category, trying to assign all these people to a category. That can become a little bit challenging. And I like to think of sexual orientation more of like a 3D space where you can literally you find a point in that space. Like it's actually bigger than a spectrum. But a spectrum is a little bit easier for us to understand. So that's kind of how we discuss these things. So we're going to start talking about some particular categories of sexual orientation. Again, I want to preface that by saying that there may be folks outside of these categories that may identify outside of these categories. So heterosexual, also known as straight. Heterosexuals are romantically attracted to those of the opposite sex, or gender, I should say, opposite gender different than their own. Homosexual, that is someone who maybe identifies with gay or, queer or lesbian, but that means that they're attracted to gender similar to their own or of their own gender. You also have aromantic. That means that person who falls in this category has little or no romantic attraction to others. So aromantic individuals likely have little or no desire to pursue romantic relationships. Then you have, on the other hand, asexual. Those are folks who have little or no desire in sexual or little sexual attraction to others. So unlike aromantic folks, asexual folks may want a romantic relationship, but not necessarily have a desire for sex in that relationship. Then you have bisexual, which means that you have sexual attraction to both genders, men or women. Bisexuals keep their range of attraction limited to two specific categories. So that means that you're either, it's a either or type of thing for bisexuals. And don't get it twisted that a bisexual can actually, you choose to only date men at a period of time or women at a period of time. It's no real restraint or constraints on that particular category. Also, you have pansexual. So the prefix pan comes from the Greek suffix meaning all. So pansexual people may feel attracted to people of any gender or any gender identity. So that could be male, female, transgender, queer, etc., etc., etc. But that all means that they're really attracted to, there's no limitations on, from a gender or, identity standpoint that, they're attracted to all people. And then you have panromantic. Panromantic is a person who is romantically attracted to all people, people of all gender identities, but not really into the sexual aspect of the relationship. So that means that they are romantically attracted to, can be romantically attracted to all genders, but not necessarily sexually attracted. And then you have demisexual. So that means that if you fall in this category, you're not experiencing sexual attraction unless there's some sort of emotional connection. So sometimes I think I fall into that category because it takes a lot for me to be sexually attracted to someone. But yeah, so that's what demisexual means. So a little bit more about bisexuality. So a common misconception about bi folks is that they are seeking to reinforce a rigid gender binary. But the reality is that bi people have the potential to be attracted romantically or sexually to people of more than one sex or gender. So not necessarily at the same time, as I mentioned earlier, but not necessarily in the same way either. So it's not necessarily a degree that a person who's bisexual have to conform to, right? So they can kind of pick and choose, and they may want to, I shouldn't say pick and choose, but they have feelings that express across multiple genders. So the term pan, again, identifies an additional opportunity for those people to fall, for that attraction to fall outside of that male, female, man, woman gender identity. So what does it mean again to identify as pansexual? Pan folks have been around forever. It's nothing new. Like, these people have exist. However, it is more of a newer term that folks have become familiar with. So again, the pan identity doesn't get much media coverage, or we don't discuss this a lot. But it basically means that, you're attracted to all gender identities or all people regardless of their gender. All right, so we use the term sex, and we constantly use the term sex to talk about, more broader topics that to include sexual, being sexual, sexuality, sexually, homosexual, heterosexual, pansexual. It's a lot. So, but it's important to not hypersexualize any community based off of the particular category they identify with. So terms like homosexual, heterosexual, bisexual, pansexual simply refers to what a person is attracted to. It helps them identify and creates a space that they could fall into and help identify the people they're attracted to. So it doesn't necessarily mean that because you're homosexual or you're pansexual that you're more sexually active than a straight person. That is not the case. So when you go out to the world and you talk to people and they might tell you that they're pansexual or bisexual, don't hypersexualize these people or impose your ideas of increased sexual practice onto them, because that's simply not true. Also, most important thing to remember is that these sexual identities are for the person who are choosing to identify or who are identifying that way. And whatever feels right for that unique individual is not for anyone else but the individual themselves to really have a place in a community where they can identify. All right, so moving towards sexual practice. You can't talk about all these things without talking about sexual practice. So it is important to remember that your sexual orientation does not necessarily communicate what types of sex or sexual practices you consent to engage in the community. So, for example, if you're gay, you may not enjoy receiving penetrative sex. There are a lot of gay men who don't like it. And so it's really, good not to just assume that because a person is this thing that they like that thing. That's not the case. So sexual practices and sexual relationships are individualistic. Those are determined again by the person and what they like and what they're interested in exploring. It's not necessarily a category that sexual practices fall into. So it is important to have conversations around sex with your partner so that you get an understanding of what their interests are, what their limitations are, and those things. So talking about sex is definitely a tool that you can use in your sexual health kit to help overcome certain barriers in relationships. So make sure that you use that tool. A lot of people don't know that it is a tool, but it is. Having conversations around sex also helps you and your partner prepare for safer sex. And so if you're having transparent conversations about sex, you can be more prepared for whatever activities you all are planning to do when you're having sex. So it's all about reducing your risk to STIs and HIV and obviously, not obviously, but also planned pregnancy. It is something you are not, if it's something that you are not ready for, then this is really important that you communicate. One more thing I'd like to point out is that you can call our Whitman-Walker community health team anytime. If you have questions or any concerns about any of these things that we discussed, you can reach us at 202-797-4439. We can help you get linked to sexual health resources. Again, we offer those free HIV, STI testing. But you can also gain other tools like access to PrEP. Or PEP if you need that. So PrEP is a daily pill that prevents HIV that is transmitted through sex, and it does effectively prevent that up to 99% if you're taking the pill daily. It is an HIV prevention option for all genders. It does not prevent pregnancy or STIs. So it is still important if you're taking PrEP to use other tools like contraception and barriers like condoms or dental dams or whatever else that tools that you use in your bedroom. That's it. Do we have any questions? I know it's a lot. Sexual orientation is complex. I'll say that. And it's really hard to map out certain things. But, all these things happen, or all these things are open to discussion. If you are interested in having more discussions like this, you can reach out to me. You can reach out to our team at Whitman-Walker. We are available. Also, I do want to remind folks that we are still in a pandemic. Yes, we are. And so it is extremely important to continue social distancing to prevent the spread of COVID-19. If you don't know what social distancing is, I don't know where you've been, but I'll repeat what it is for you. That means that you have to stay at least 6 feet away from other people whenever it's possible. You wear a mask in public, avoid large crowds in any place. Encourage work from home if you can. Also, if you want to spend time with family, definitely encourage you to speak with those loved ones over FaceTime instead of in person. And if you think you may be at a particular risk, for getting, extremely sick from COVID-19, then it is extremely important for you to social distance to help prevent the transmission to yourself and to other people. Also, remember that people can have no symptoms of COVID-19 for 2 to 14 days after exposure. So that means that they'll be able to pass that on to someone else with unknowingly, if they're not having any symptoms. So keep that in mind, which is why it's extremely important to wear your mask, stay socially distanced. You can also visit Whitman-Walker.org/distancing care for support with navigating any needs that you may require with social distancing. Also, we are still here for you. Be kind to one another. We'll get through this together. But I also want to remember you all to continue to follow us on Instagram, Facebook, and Twitter at Whitman-Walker. We are always posting more updated information about our services, but also around topics like these. So if you are interested in more information and more content, tune in at Whitman-Walker across all of those social media platforms I just mentioned, Instagram, Facebook, Twitter. Also, tune into our youth team on Instagram. That is Real Talk DC _ again, at Real Talk DC _ And that's all I have for you today. I hope this was informative. Hope you learned more about, the sexual, gender, sexuality, and sex spectrum, because it is bigger than just a binary. But all of them are bigger than just a binary concept. So thank you all. In your opinion, why do you think the majority of the world operates in a universe of people are one or other gay, straight, or bi? I think those are, that's a good question. I would say because so again, having the idea of, man and woman being a social construct, it was literally created and designed by society. And so when we have a concept like that and like people start, expressing themselves in different ways, it's really hard to put people in a particular bucket. And I think it's a lot easier for people to understand, man or woman, but it's not really on us to, the limitations is on them, not on us. And so sexuality, gender, all that is more complex than just male, female, gay, straight, or bi. And so now that, people are becoming more familiar with these, with sexuality being a spectrum, you'll probably start hearing more and more about, these concepts I just mentioned. But I think the majority of the world operates in a universe where they think it's just gay, straight, or bi because of the social aspects of that we literally didn't have any control of. It's just easier for people to just accept that. People fear the unknown, and when you say you have a spectrum of things that it's hard to categorize, I think it's just easier for people to stick with that. But we don't like easy, right? So we want to make sure that we're cognizant that, sexual orientation is a spectrum and do it to the best of our ability to accept that for people. Yes. That's a great question, though. And yes, we all need to relearn. I'm still relearning. I identify as gay today, but I constantly, question, whether that is going to be the case forever. And so, and that's okay, right? We don't have to be one thing today and the same thing tomorrow. Humanity is complex. And within that, sexual orientation, gender, sex, all of that is just as complex. Great question. Alrighty, well, this was good. I am happy that you all joined me. Again, I want you all to follow Whitman-Walker on Instagram, Facebook, and Twitter, and then follow our group Real Talk DC _ on Instagram. It was great speaking to you all, and I hope you all have a great evening. Bye-bye.